January 1945. The jungle is thick with smoke and the stench of mud and cordite. Explosions echo in the distance, shaking the ground beneath the feet of weary soldiers. The air is humid, sticky, filled with the sharp tang of sweat and gun oil. A small detachment of Japanese soldiers, exhausted, bloodied, and bewildered, moves cautiously through a clearing. Ahead, a cluster of white tents stands in stark contrast to the chaos around them. Red crosses flutter gently in the humid wind. Inside, orderly rows of cots, nurses moving with precise calm, and the soft hum of medical equipment create an almost surreal atmosphere. For men who have seen makeshift battlefield aid stations, crude bandages, and minimal care, this display of efficiency is disorienting. A Japanese private hesitates at the edge of the clearing. His eyes widen as he observes a wounded American soldier receiving morphine, clean linens, and careful attention, while an orderly meticulously charts his condition. The soldier, despite the injuries, smiles faintly at a nurse offering a cool drink. In that moment, the private's understanding of war's brutality collides with an unexpected vision of humane treatment. The clearing, though within a war zone, feels momentarily untouched by the chaos that surrounds it. This juxtaposition of violence and care would soon ripple through the perceptions of the soldiers, altering their expectations of the enemy. The strange, almost alien orderliness of these hospitals cannot be understood without first examining the broader context of the Pacific War, the intensity of the battles and the conditions that made such care so extraordinary. By late 1944, the Pacific Theater had become a relentless test of endurance, strategy, and resourcefulness. The Allied advance, spearheaded by the United States, pressed from island to island, encountering entrenched Japanese positions in dense jungles, volcanic ridges, and coral atolls. Each campaign, from the bloody battles at Saipan and Leyte Gulf to the grueling approach toward Iwo Jima, was marked by extreme physical hardship, disease, and supply shortages. Japanese soldiers, trained in rigorous discipline and indoctrinated in Bushido, faced not only American firepower, but also the relentless strain of tropical disease, malnutrition, and isolation. U.S. forces, in contrast, had systematically built a medical logistics network capable of supporting massive operations. Field hospitals, mobile surgical units, and evacuation chains were integral to strategy. At the front lines, medics carried triage kits and portable surgical tools, stabilizing the wounded for rapid transfer. Behind the lines, base hospitals were equipped with sterilized instruments, electricity, running water, and trained medical personnel, including nurses and orderlies. These facilities contrasted sharply with Japanese field care, which often relied on improvised materials, limited medicines, and minimal surgical intervention. The discrepancy was not merely a matter of comfort. It reflected a broader strategic commitment, the preservation of manpower to sustain offensives. U.S. commanders recognized that soldier survival directly impacted operational effectiveness. Casualties were inevitable, but the ability to treat, rehabilitate, and return men to duty created a multiplier effect in combat readiness. For the Japanese, such systematic care was almost unimaginable. Propaganda emphasized stoicism and sacrifice. Surrender or reliance on enemy assistance was culturally stigmatized. In this environment, the sight of well-organized, clean, and humane field hospitals appeared almost surreal. Japanese soldiers, trained to expect death, scarcity, and brutality in the care of the wounded, confronted a reality that challenged deeply ingrained perceptions. The very idea that an enemy could treat human suffering with such structure and attention defied both expectation and experience. The significance of these hospitals can only be understood by examining the operations that brought troops to these front lines, the conditions under which soldiers fought, and the medical strategies employed to sustain massive campaigns across the Pacific Islands. The Pacific campaigns of 1944 and early 1945 were defined by a combination of naval dominance, amphibious assaults, and attritional land battles. The U.S. island-hopping strategy sought to bypass heavily fortified positions, isolating Japanese garrisons and securing strategic airfields. Each landing, Guadalcanal, Peleliu, Leyte, and later Iwo Jima, required intricate coordination of naval bombardments, aerial strikes, and ground maneuvers. For Japanese defenders, this often meant fighting in isolation under relentless bombardment and with severely limited supplies. Japanese field medical practices reflected these constraints. Supplies were scarce. surgical facilities rudimentary, and evacuation over jungle or coral terrain slow and dangerous. Soldiers often relied on field dressings, local herbs, and the skill of medics with limited equipment. Evacuation chains were inconsistent. Injured men sometimes waited days without care. Disease, malaria, dysentery, and tropical infections was as lethal as enemy fire. Mortality rates for wounded Japanese troops in these conditions were significantly higher than for their American counterparts. U.S. medical operations, by contrast, were highly organized. Forward surgical teams followed close behind assault waves, performing life-saving interventions within hours. Casualties were triaged. Those requiring immediate surgery received it. Others were stabilized and transported via amphibious craft, motor ambulances, or specially equipped aircraft to field hospitals. These hospitals were stocked with sterilized instruments, adequate anesthesia, and pharmaceuticals. Nurses maintained sanitation and comfort, monitoring patients continuously. Reports from medics highlight the striking efficiency and the morale boost provided by such care. The psychological impact on Japanese soldiers encountering these hospitals was profound. Beyond the immediate shock at cleanliness and comfort, there was a cognitive dissonance. An enemy who inflicted death so ruthlessly could also preserve life with such meticulous care. Letters and post-war testimonies recount Japanese troops' surprise at clean sheets, nutritious meals, attentive nursing, and even the provision of ice, something nearly unimaginable in the tropical battlefield. For many, it challenged their understanding of warfare itself, introducing a moral and cultural disorientation in the midst of brutal conflict. These conditions set the stage for the pivotal human interactions and tactical observations that would later define soldiers' perceptions of U.S. medical operations. Understanding the contrast in medical practices is essential before examining the multiple angles from human experience to leadership decisions that made these hospitals both extraordinary and strategically significant. For Japanese soldiers, the first encounter with U.S. field hospitals was a jarring sensory experience. Accustomed to the chaos of makeshift aid stations, muddy floors, scarce bandages, and the absence of basic comforts, the clean tents, orderly cots, and attentive nurses of an American hospital were almost incomprehensible. Wounded men received prompt surgical care, pain relief, and hygiene maintenance. Letters from Japanese prisoners describe a mixture of awe and confusion, the enemy treating them not as foes to be discarded, but as human beings deserving care. This humane approach disrupted entrenched wartime narratives of cruelty and invulnerability. Soldiers questioned not only their assumptions about the enemy, but also their cultural conditioning that glorified suffering and disdain for surrender. Field hospitals were not merely humanitarian operations. They were tactical instruments. By efficiently stabilizing and returning soldiers to combat readiness, the U.S. maintained a sustainable offensive tempo. Forward surgical units were positioned within striking distance of front lines, reducing mortality from treatable injuries. Medics carried essential supplies, enabling immediate intervention. The visibility of these hospitals to enemy observers sent unintended signals. American forces were well-resourced, disciplined, and capable of sustaining prolonged campaigns. For Japanese commanders, witnessing the organized evacuation and treatment of U.S. casualties highlighted a disparity in logistical capacity that influenced operational planning and morale assessments. Medical technology amplified the effectiveness of these hospitals. Sterilized surgical instruments, portable X-ray machines, anesthesia, and morphine were standard, even near the front. Mobile surgical units could perform amputations, remove shrapnel, and address internal injuries under controlled conditions. Contrast this with Japanese field care, often limited to antiseptic washes, splints, and rudimentary dressings. The availability of electricity, clean water, and controlled environments in U.S. units allowed complex procedures to succeed at rates previously impossible in forward zones. This technological edge transformed survival probabilities, reshaping the psychological and physical calculus of combat. Command structures prioritized medical readiness. Officers understood the correlation between casualty survival and operational endurance. Hospital corpsmen and nurses operated under strict hierarchies, maintaining efficiency in triage, treatment, and documentation. Training emphasized both skill and discipline. Redundancy systems ensured no gap in care. Leadership extended beyond the physical hospital. Logistical coordination, Supply lines and evacuation protocols were integrated into overall campaign planning. For Japanese observers, the sheer systemic rigor appeared alien, an enemy capable of simultaneously fighting, sustaining, and caring for troops at scale. The cumulative effect of these dimensions, the human, tactical, technological, and leadership aspects, created an experience that was simultaneously practical, disorienting, and illuminating. The astonishment of Japanese soldiers was rooted not merely in comfort, but in witnessing a systematic approach to preserving life amidst the machinery of death. Japanese soldiers' astonishment extended beyond personal experience to broader strategic observation. Reports and post-war testimonies indicate that even low-ranking soldiers recognized the efficiency of U.S. medical operations as a force multiplier. Observing the rapid treatment, evacuation, and return of wounded American troops revealed a level of logistical sophistication that contrasted sharply with their own overstretched systems. For Japanese commanders, this discrepancy necessitated adjustments in tactics, often resulting in more entrenched defensive positions to inflict higher casualties before enemy soldiers could recover. The presence of organized hospitals also conveyed an implicit psychological message. The enemy valued life strategically, not sentimentally, and could sustain offensive operations longer than expected. The shock experienced by Japanese troops carried a moral dimension. Rooted in Bushido and military indoctrination, surrender or reliance on enemy mercy was culturally stigmatized. To witness care extended even to captured or wounded enemy soldiers created cognitive dissonance. Letters and memoirs describe the internal conflict, awe at the medical competence, discomfort at the perceived softness, and uncertainty about their own wartime ethos. Some soldiers questioned the ethical framing of combat. Others interpreted the care as a manipulative tactic. Regardless, the encounter disrupted entrenched beliefs, producing a lasting impression that persisted beyond immediate battlefield experiences. Field hospitals exemplified the integration of medical logistics into broader operational planning. Efficient casualty evacuation prevented battlefield attrition from collapsing unit strength. Rapid treatment improved morale, encouraged resilience under fire, and allowed experienced soldiers to return to frontline duties. Japanese intelligence recognized the operational advantage conferred by this system. The presence of well-equipped hospitals, staffed by trained personnel, indicated a capacity for sustained campaigns, influencing enemy expectations and defensive planning. The ability to maintain troop strength through systematic medical care became an unspoken component of American military dominance in the Pacific. Beyond physical care, the visible organization of U.S. hospitals functioned as psychological leverage. For exhausted and injured Japanese soldiers, witnessing an enemy capable of transforming the chaos of battle into controlled medical efficiency induced a sense of vulnerability and awe. The stark contrast to Japanese field conditions, where injury often meant slow death or neglect, created both demoralization and admiration. This psychological impact, while subtle, influenced combat behavior, surrender rates, and long-term perceptions of the United States' wartime capabilities. These angles, human experience, tactical efficiency, technological advantage, leadership, enemy perspective, moral dissonance, and psychological impact, intersected to define the profound impression U.S. field hospitals made on Japanese soldiers. They were not merely care centers. They were instruments of operational strategy, cultural confrontation, and psychological influence. Understanding these dimensions is critical to contextualizing the climactic encounters on the battlefield, where these hospitals' role extended beyond treatment to shaping perceptions, morale, and the course of engagements. February 19, 1945. The landing at Iwo Jima begins under a pre-dawn sky, the horizon barely distinguishable through a haze of smoke and mist. U.S. Marines descend from Higgins boats onto black volcanic sand, met immediately by entrenched Japanese defenses, fortified bunkers, concealed artillery, and a network of tunnels carved into the volcanic ridges. The roar of naval bombardment mixes with machine gun fire, creating a disorienting, almost apocalyptic soundscape. Amid this chaos, the wounded begin to accumulate rapidly. Forward surgical teams are deployed just beyond the beachhead. Field hospitals, though under threat from shell fire, operate with systematic precision. Casualties are triaged, wounds cleaned, shrapnel removed, and morphine administered. Nurses maintain composure under fire, documenting procedures, adjusting bandages, and calming the injured. Every minute saved on the beach translates into survival. Every stabilized patient reduces overall attrition. Japanese soldiers observing these operations are caught between tactical engagement and bewilderment. Men crawling through mud-streaked trenches see Americans moving swiftly to evacuate their own under identical fire. The realization sinks in. This enemy, capable of inflicting death, is equally capable of preserving life with disciplined efficiency. Instances are documented of Japanese combatants pausing to watch, astonished at the coordination, the order, the lack of panic. The scale of casualty treatment becomes a turning point in perception. Whereas previous battles had established a brutal standard of minimal care, Iwo Jima reveals a sophisticated medical network capable of sustaining human life under extreme conditions. For Japanese soldiers, the shock is compounded by the psychological implications. Their assumptions about the inevitability of American casualties are overturned, and the battlefield calculus shifts. A soldier who might have expected an advantage from inflicted wounds now confronts an enemy whose resilience is actively maintained, altering both immediate tactics and broader strategic planning. This moment, where survival, efficiency, and human compassion intersect amidst the maelstrom of battle, marks the first significant rupture in Japanese expectations. The operational superiority of U.S. medical logistics transforms from abstract strategy to visible reality, foreshadowing decisive outcomes in the campaign and beyond. March 1945. Okinawa, the last major obstacle before the Japanese home islands, becomes a crucible of endurance and tactical ingenuity. Kamikaze strikes, entrenched artillery, and cave networks define the battlefield. Casualties mount at unprecedented rates, challenging even the most robust medical frameworks. Yet U.S. field hospitals adapt. Mobile surgical units are positioned within striking distance of the front lines. Evacuation chains operate continuously, transferring the wounded from beachhead to intermediate care, then to fully equipped base hospitals. Nurses, corpsmen, and doctors move with choreographed efficiency, each step pre-planned, each patient tracked. Japanese observers, captured or surviving soldiers, note the contrast starkly. Men injured in initial assaults are quickly treated, fed, and returned to the line if capable. The wounded who cannot return are not neglected. They receive ongoing care, hygiene, and attention, often within view of enemy combatants. Reports describe the psychological impact: astonishment, disbelief, and in some cases, hesitancy to engage fully when anticipating the resilience of their adversaries. The enemy's perception of invincibility is fractured by the realization that every casualty inflicted is mitigated by systematic care. The efficiency of these operations directly influences the battle's tempo. Units can sustain forward momentum despite heavy losses, reinforcing the operational doctrine that manpower preservation is as vital as firepower. Japanese commanders, recognizing the operational edge conferred by medical logistics, adjust defensive strategies, extending supply lines and entrenching further. These adjustments, while tactically sound, cannot entirely offset the combined force of U.S. artillery, air support, and the rapid replenishment of personnel facilitated by field hospitals. In this crucible, the full implications of the U.S. medical system crystallize. It is not merely a support function. It is a force multiplier, a psychological instrument, and a cultural revelation for the enemy. Soldiers on both sides are transformed by these encounters. Some Japanese troops internalize the shock, others recalibrate expectations, and a few begin to understand that the American approach to preserving life under fire represents a new dimension of warfare. The battlefield, once defined solely by combat and attrition, now carries a parallel narrative, that of care as strategy, humanity as weapon, and survival as a decisive element in victory. By mid-1945, the cumulative effects of U.S. medical operations in the Pacific were evident across multiple campaigns. Casualty survival rates had increased significantly compared to earlier conflicts, with wounded soldiers frequently returning to active duty after treatment. Field hospitals, forward surgical teams, and evacuation protocols had transformed attritional warfare into a system where human life was preserved and redeployed as a strategic asset. These measures contributed to sustained offensive capability, reinforcing the momentum of island-hopping campaigns and enabling the Allies to press toward the Japanese mainland with unprecedented efficiency. Japanese troops and commanders were forced to reconcile with these realities. Accounts from survivors and prisoners of war detail persistent astonishment at the level of care. Sterile bandages, anesthesia, medical charts, and attentive nursing defied expectations formed by years of brutalized battlefield conditions. Cultural shock compounded the tactical implications. Soldiers who had anticipated the enemy's collapse under fire instead confronted a resilient force, continually replenished and reinforced through a combination of combat and medical strategy. The psychological weight of this realization shaped both morale and engagement tactics. At the operational level, the contrast between U.S. and Japanese medical logistics became a critical factor. Where Japanese units often suffered catastrophic losses from treatable injuries or disease, U.S. forces maintained troop strength through rapid intervention. Official reports note that surgical units on Okinawa performed hundreds of operations daily under combat conditions, with survival rates exceeding those in earlier Pacific engagements. The ability to evacuate, stabilize, and rehabilitate wounded soldiers created a multiplier effect. Frontline units remained capable, commanders retained flexibility, and the enemy confronted an adversary whose apparent losses did not translate into proportional weakening. This intersection of human care, operational strategy, and battlefield reality marked a turning point in how warfare was perceived by both sides. Japanese soldiers, already fatigued by prolonged campaigns, began to understand that the American approach to medical treatment was not a peripheral convenience, but a decisive instrument shaping combat outcomes. The consequences of these practices would reverberate through the final months of the Pacific War, influencing tactics, morale, and the eventual path to Allied victory. By the conclusion of the Okinawa campaign in June 1945, the impact of U.S. field hospitals was fully apparent. Thousands of wounded soldiers had survived because of rapid triage, skilled surgical intervention, and organized evacuation chains. Base hospitals, operating with full medical infrastructure, ensured that even severe injuries could be treated effectively. The result was a sustained fighting capability that allowed U.S. forces to maintain operational momentum despite high casualty rates. Reports from the U.S. Navy and Marine Corps emphasized that medical logistics were as critical to success as artillery and air superiority. For Japanese soldiers, the long-term impression was profound. Those who survived encounters with U.S. hospitals documented experiences of astonishment and disorientation. They observed order, hygiene, and structured care that stood in stark contrast to the improvisation and scarcity they endured. Letters and memoirs recount the internal struggle between respect for the medical skill and the cultural imperative to view such mercy with suspicion. The experience challenged the traditional notions of honor, endurance, and sacrifice, leaving a lasting cognitive imprint on the soldiers who witnessed it firsthand. Strategically, the survival and rehabilitation of U.S. troops influenced campaign outcomes. Units could reconstitute faster, casualties did not permanently diminish fighting capacity, and the psychological impact on both allies and enemies was significant. Commanders could plan assaults with greater confidence in their forces' resilience, while Japanese defenses faced the relentless pressure of a well-supplied, continuously reinforced adversary. The efficiency of these medical operations became an unspoken force multiplier, shaping both tactical decisions and broader operational planning. Post-war analysis reinforces this assessment. U.S. military reports highlight that medical readiness directly contributed to lower attrition, improved morale, and operational sustainability. Japanese observers, in contrast, recognized the contrast between their losses from preventable injuries and disease and the Americans' systematic care. The juxtaposition crystallized a central lesson of the Pacific War, that the preservation of life within the machinery of war can serve as both a practical strategy and a psychological instrument, shaping the course of combat and the perceptions of those who face it. The image of U.S. field hospitals in the Pacific stands as a testament to the intersection of humanity and strategy in modern warfare. Amid volcanic sands, jungle mud, and the constant roar of battle, these institutions preserved life with methodical precision, transforming chaos into order. For Japanese soldiers, encountering such care challenged deeply ingrained notions of honor, endurance, and the expected brutality of combat. The cognitive dissonance was profound, An enemy capable of delivering death could also administer life with skill, compassion, and discipline. Beyond individual experiences, the implications were strategic. Medical readiness became an invisible weapon, amplifying combat effectiveness, sustaining morale, and influencing tactical calculations. The preservation and return of wounded soldiers shifted the balance of attrition, demonstrating that human survival could serve as a decisive factor in operational success. These hospitals were not peripheral. They were central to victory, shaping the tempo of campaigns and the resilience of forces under extreme conditions. Historically, this episode underscores a critical evolution in warfare, the integration of care into strategy. It challenges the assumption that war is defined solely by destruction, revealing that the systematic preservation of life can coexist with, and even enhance, military objectives. For the soldiers who witnessed it, for the campaigns it sustained, and for history itself, U.S. field hospitals represent a paradoxical force. Mercy rendered with precision, efficiency serving both humanity and victory, and the enduring lesson that organized compassion can be as transformative on the battlefield as any weapon.